Vanakkam. I am Dr. Rajarajan Venkateshan, vascular and endovascular surgeon, working in Apollo Hospitals, Grims Road, Chennai. Today I'll be discussing about a very complex vascular injury of a patient whom we have treated with a multidisciplinary team and saved his leg. And we'll be talking to him, Mr. Malkas from Georgia. Can you just tell about you and what have you encountered when you were working on June 23rd?
It was cargo operation going on deck 2 and loading aluminum coils. It was after some break time, and stevedores also left, and intervenes with cargo operation, bosun, also second man, and AB. When I informed chief officer completed deck 2, it means remain only deck 5. He said me proceed deck 5 and help them to align and put containers. Okay, chief officer okay, I proceed and load containers. 3 containers or 4 containers, it was when I look on the jetty, standby. These 3 containers which remain, they can also put all 3 containers, and after that it take a few minutes.
Okay.
No need to earlier
Okay, rush up.
put chains, and these chains which they put come out very long. And when they bring another containers, I not pay attention. It was 34 degrees. It was very hot, and I no imagine they put so quickly these chains. And when they putting another containers, also bad weather it was also previous days and these days also, because the breakwater looking exactly general cargo bed, and these waves hitting and the vessel shaking.
Okay.
And when they pick up also, this also must be noticed. When they pick up these bosun pick up containers, these containers shake and start moving direction to me. And when they put these chains, of course I start retreat back, but these containers approach me, behind the chains stop me.
Okay.
And already crash my legs.
You get caught, leg get caught.
Yes, he catch me right leg, but if these containers catch me full body, not remain nothing. After some time, these containers release to me, and I start shouting.
All right.
And such strong pressure it was from these containers. This chain from the foot, it was attached. The chain cast off. Itself cast off. I don't know. Maybe God cast off. I don't know. But after I feeling strong pain, I shouting. Everybody rush it. And after half an hour, maybe more, the ambulance come. They put me in the car and directly rush it to the hospital. And this hospital, they directly make X-ray. Some of the X-ray, I not remember, 2, 3 X-ray remember. And after they check situation, and they said me, her fracture.
Okay.
Her broken, and everything must be okay. Try to walk. When I put the right leg, I no feeling foot area, absolutely no feeling. And I told I can't walk. And close to me it was sisters, reception sisters, and they said me, you must pray. Maybe they will cut your legs. It was for me shocks. After I waiting situation, it means that they have some correspondence or some call with Bahri office. And after decided I to transfer another hospital. They bring me Apollo hospital, as I find out later on. And first, as I understand, my treatment doctors, it was Dr. Rajarajan and Dr. Pravin.
There was a suspicion of vascular injury. Myself, I was called for the immediate help, and then as soon as I saw the patient, his limb was completely cold from the mid leg to the foot, and the sole of the foot was blue. It was dusky in color, and there is no flow or there is no pulse, and there is no movement of the toes and the ankle joint. So it was completely insensate and ischemic limb when I examined. So within 1 hour, we could shift him for an urgent CT angiogram, confirm the diagnosis of the right popliteal artery injury with the compartment syndrome, and this whole leg was tense and the muscle also was crushed. So immediately the anesthesia team was involved and the theater was called. He was taken up for an emergency surgical, emergency surgery, where we found that there was a complete cut off for the right popliteal artery with a 1 liter of blood inside in the cough, where the muscles were crushed, and the small vein is taken from the left leg and did a small grafting of the popliteal artery and did the debridement and left the wound open. So we did long fasciotomy as well, so that for the whole muscles to breathe out, so that there won't be any kind of compression effect which may even damage. Within 6 hours, if you re-establish the circulation, the risk of limb loss or sometimes even life also we can prevent. So we could take him to theatre within 12 hours and re-establish the circulation in 1.5 hours time. So by the time itself, it was near about 13 hours of ischemia time. So after the surgery, he was put on the intensive care unit with the help of anesthetists, and the critical care consultants were helping out for intense monitoring of the wound, and also his creatinine was going up because of the crushed muscles. We had to involve the nephrologist, and every hour we were checking the pulse and how is the flow, and it was re-established. Though it was the pulse and all were re-established, the muscles were not much contracting, and we had to take him for repeated surgeries, near about 6 debridement surgeries, cleaning with the help of plastic surgeon Dr. Leela Praveen. And so once in between, because of from the crushed muscle, he was growing some deadly organism, and also repeated cultures of the muscle which were debrided tissue were growing cultures repeatedly, and he was having intermittent fevers and rising blood counts. So we were really worried whether he may go in for a septic shock. In that situation, there is always a risk of anytime, we were just warning him, anytime risk of amputation, that too up to abonia amputation if at all if required. So with involving the infectious disease consultant Dr. Ram Gopal Krishnan, so we were along with we were treating with the very broad spectrum antibiotics and regular dressings, twice a day dressings, and a lot of nursing care was given for him. And after some time, after the 6th surgery, we had after the long fight, we came to some kind of positive response. The wound started granulating, and we decided then to put a skin grafting, and that was the 7th surgery he had undergone, and the skin graft, luckily it was taken out, and slowly the physiotherapists were involved for rehabilitation. Now he started walking on his own, the pulse is felt, and the sensation slowly started regaining, and some movement, foot and toe movements were regained, and now he will explain how he has recovered, how he is doing now.
Present moment, this Apollo Hospital, Chennai, bring me from critical situation, stand on the leg, I can walk, little supporting, beginning and after without supporting. And the pain no have, when I horizontal position, absolutely no have pain.
A multidisciplinary team is always important in this kind of situation, like if the patient comes in delayed time, like beyond the golden hour, you need to involve many kind of specialities to bring back the patient's limb as well as life.
This accident which happened, Bahrain National Shipping Company of Saudi Arabia established for me Apollo Hospital Chennai, and where I get proper treatment and reliable treatment, and this is a fact. After 1 month and few days, after critical situation, I am vertical position. It was very exciting moment when I see Georgian ambassador give me such honor, and he visit to me. Thankfully all parts, very thanks everybody which take part, and I get second life. Thanks everybody. Thank you very much.